So we are continuing to follow reaction and the latest when it comes to the sudden death of Senator Lindsey Graham. So happening right now, the FBI outside, well, I should say at the home of Senator Graham's, his D.C. home there. We're still working to get details on why they are exactly there at his house in D.C. But again, the FBI there at his home in Washington, D.C. So Senator Lindsey Graham was one of President Trump's closest allies in Congress, who traveled the globe to advocate for a more aggressive U.S. foreign policy. He died over the weekend after a tear in his aorta. That's a preliminary report from the medical examiner, their finding from recently. So it's a developing story that we continue to get questions about, and we continue to dig into, and let's dig into it. So we have Dr. Ashish Jain from Novant Health here to break this down for us. Dr. Jain, thank you for joining us here on the program.
Of course. Thanks, Nick.
So a lot of questions about aortic dissection. I think I'm saying that right, aortic dissection. What is it? Because I've gotten questions. There have been a ton of breakdowns on different platforms about it. But from your assessment, what is this?
Sure. And let me just first start by extending my deepest condolences to the Graham family. It's a tragic loss, and my thoughts and prayers are with them during this incredibly difficult time. Aortic dissections are an uncommon but very dangerous condition. The aorta is the biggest blood vessel in the body. Think of it like a large pipe that extends from your heart down throughout the rest of the body, carrying blood flow everywhere. That pipe has a wall, and that wall is comprised of 3 layers. And a dissection is where that innermost lining of that wall tears away from the rest of the wall. When that happens, blood, of course, can still travel through the pipe where it should go, but also starts to travel through the wall of the artery itself that can lead to various complications, the most dreaded of which, of course, is a fatal event. This is certainly a dangerous condition.
How does this compare to any other cardiovascular emergency?
I think it depends on the type of dissection. So when we talk about aortic dissections, there's some that are closer to the level of the heart called a type A dissection. There's others that kind of extend away from the heart called a type B dissection. When we talk about dissections that are most likely the immediate cause of death, we're worried mostly about type A dissections. These, I guess you could most closely relate to things like a ruptured aneurysm, where patients can immediately start to bleed into dangerous places that can lead to loss of life. The NIH estimates around 13,000 cases of patients dying every year from these aortic dissections, and many of those patients don't even make it to the hospital. And so it is a very dangerous kind of immediate cause of death for many people.
And for us, this news of Senator Graham, it is so sudden. A lot of folks are shocked, but there are symptoms. What are the symptoms and that would make someone call 911, go to the ER?
The most common symptoms we hear about are chest pain radiating to the back. Many people describe kind of this tearing chest pain, the worst they've ever had. Feels like someone's stabbing them straight from the chest through the back. Many people will also describe things like tearing pain between their shoulder blades. The pain is severe enough that people are very uncomfortable, and it almost always requires a phone call through EMS to get to a hospital as quickly as possible. Sometimes the symptoms can be less apparent. Many patients will describe kind of vague symptoms, things like abdominal pain, discomfort, kind of what patients sometimes describe with acid reflux or a heart attack. So sometimes it can be a little bit more challenging, to kind of really diagnose based on symptoms, but tearing chest pain, sharp chest pain, all the way through the back is the most common feared symptom that we worry about.
When you have those symptoms, I know the notion is, yes, go to the ER 911, but immediately, what do you do? Is it sitting down? Is it laying down? What do you immediately do once you experience these symptoms?
Yeah, most patients aren't able to find a comfortable position at all. The symptoms are so severe, but we certainly advise staying in kind of a safe location, being seated as opposed to standing to avoid any additional trauma or anything like that, and getting to the hospital as soon as possible.
My last question, and Dr. Jain, you've been so generous with your time here on this program. Who's most at risk for an aortic dissection?
Generally speaking, when we talk about at-risk patients, it's mostly patients in an older age, above the age of 65, mostly patients that have carried a longstanding history of high blood pressure, cholesterol, atherosclerosis in medical terms, or as the medical examiner's office described, arteriosclerosis, which is basically hardening of the arteries related to high blood pressure, cholesterol, and things like that over a long period of time.
Dr. Ashish Jain from Novant Health, thank you again for that breakdown. Again, a lot of questions, so hopefully this answers a lot of questions for folks who are just curious about this. Again, thank you, Dr. Jain, for your time.
Of course. Thanks, Nick.